got freezing rain in the forecast. Also in the forecast is we're starting to get those winter colds. We have paged Dr. Paul. He is joining us this morning, and we're looking at some of the symptoms that a lot of us are going to experience over the next couple months, and some of the solutions. And for you, it's trying to avoid as much as possible, especially with our young kids, taking the over-the-counter medication.
That's right. The over-the-counter medications are not 100% safe, and we know that they're actually dangerous for kids less than 6 years of age. So we try as much as possible at any age to avoid them. Certainly, kids less than 6 years of age, those over-the-counter cough suppressants should not be given.
You mean we shouldn't be giving them so that we knock them out and they go to sleep?
Well, actually, yeah, that's, it's tempting, but
right.
No, the reality is that there have been a lot of kids who overdose on these medications, and some have unfortunately died or nearly died. So the bottom line is that viruses, most of the colds and flus that you're going to get over the next coming months are due to viruses, which don't require any treatment, specific treatment. So there's no cure per se, except for the flu. You get your flu shot and prevent it. But there's really no treatment. So what we're talking about is symptomatic treatment, how to relieve the symptoms. And the trick that I use is if the symptom is severe enough to interfere with your working, playing, sleeping, eating habits, then maybe you could treat it. In most cases, if it doesn't, you can live with it and it goes away.
Okay, so let's take a look at some of the symptoms. Let's start with sore throat.
Okay.
So what are we dealing with there?
Well, sore throat, again, if it's isolated, it could be a bacterial sore throat. So that in that situation, if it's very bad, like a strep throat, that would require antibiotics.
Okay.
But in most situations, they can test it and find out if it's not. It's a virus. So if it's a virus, what you can do about it really is drink plenty of fluids, warm fluids. Sometimes lemon and tea and a bit of honey in it will soothe the throat, and it'll go away on its own.
Okay.
That's really no medications. There are lozenges you can take as well, over-the-counter lozenges for older people.
Okay, for older people. What about giving lozenges to our children?
I would not. I would not give lozenges because they can choke on them, and again, it has some medications in it.
Okay. One scenario. Let's talk, you moved from the sore throat, but then you're moving into the deeper cough.
Okay, deeper cough. Again, cough is a natural way of your body getting rid of the virus or the bacteria that's infecting your lungs. And so in most situations, it goes away on its own. And again, if the cough really bothers you, again, in children or in adults, you can't work, can't sleep especially, it interferes with eating and those type of things, we can do something about it. Non-medication things that you can do, again, honey, lemon, and water, warm water, soothes the throat and sometimes takes that tickle away. And the other thing that we do as well is humidity. And I forgot to say, humidity is very important, especially if you've got a cold. Humidifying the air helps you get rid of those secretions quicker.
Okay, what if you have a child that's really, it hurts to swallow?
Okay. In that situation, if you have a lot of pain, you can give a child Tempra or Tylenol, acetaminophen, not aspirin. I want to say that, not aspirin. So if a child does have pain or fever, low-grade fever, you can give Tylenol or Tempra, but only for a few days at a time, not more than that. Not more than that.
Let's go on to the stuffy nose. We're going to have a lot of runny noses.
Well, again, stuffy nose, again, responding to humidity, high humidity. In younger kids, saline drops, saltwater drops in the nose will help relieve that. In babies who can't blow their nose, what we do is we put the drops and then have a little suction pump to because they can't blow their nose, right? So as kids get older and blow their nose, that becomes less of a problem. Now, they do have over-the-counter medications, again, for older people who have a very congested nose, or if it's chronically for allergies, but let's say it's just for a cold for a period of time, you can get those over-the-counter decongestants as well, but again, only if you're uncomfortable.
Okay, and really, it's like those little miniature turkey based, right? That
exactly.
You're sucking,
yeah, exactly, for young babies, because a lot of people they put the drops in and they figure the baby's going to decongest, but you got to suck it out.
Okay, and then last, we're talking about multi-symptoms. If you've got someone, and it's like everything is aching.
Well, and there you go. You see, that's why they have these multi-preparations with symptoms for decongestants, cough, and so on. I don't believe in taking those because there's too many things in one. So you'd pick up the symptom that sort of interferes with you the most, and that one. But again, rest, plenty of fluids, humidity, tender loving care for baby, for everybody else, obviously, I think will do the trick.
Okay. Always best bet is to check out the website. You've done a great job at being able to establish and give a lot of information on Dr. Paul's website. You can see the information listed on your screen. But the big thing for you especially, and the emphasis is try to stay away from the over-the-counter, especially when you're dealing with young kids.
Especially young kids, yes.
Okay.